International Women's Day is celebrated to recognize and appreciate the hardships and accomplishments of women around the globe. VYK organized this webinar on International Women's Day to celebrate women and learn from their life journeys, their challenges, and become a better individual for the society.
I'm giving my wishes on this International Women's Day to all the beautiful ladies, women who have joined here and all the people who have joined here. So now I would like to welcome our esteemed speakers. So I'm welcoming all the panelists here on the behalf of all the team members of VYK. We are very privileged to have you all on the panel, ma'am. And the next, I would like to welcome all our participants who have joined us through Zoom and YouTube channel, and all our team members of VYK for organizing such a wonderful event. Happy Women's Day again.
अब पैंडेमिक ने अनफॉर्चुनेटली क्या किया है, it has impacted the several decades of progress that we have seen as far as girl children are concerned, and how has it affected us. If we were to look very quickly, we are now going into an entirely virtual platform and online mode of interaction. Ab pandemic ki wajah se there have been not only the pandemic but also the, if you look at the various measures, जो pandemic के measures हैं वो इसमें ज्यादा impact हुआ है, जैसे quarantine है, the travel restrictions, closure of schools, so making the schools inaccessible to all children, not just to the girl children, but there we are focusing more on girl children and looking at other factors that impact girls even more. So whether you look at the investment side in education, which again has taken a beating following the pandemic, where you have less resources to put back into the education. तो जैसे आपने पहले मिस अपूर्वा आपने जो आप थीम के बारे में बता रहे थे, you said education with minimum resources and how can we be successful. So the first thing is that, you know, we can be successful, but the fact that we need resources and that we need to keep investing public resources in education, and the dangers of going into a system jahan pe zyadatar private educational institutions aane lage hain, that is going to impact all children and all youth, and more so even the girls in particular. So now what has the pandemic done? It has caused all these different disruptions. It has girls are delegated with additional household work and childcare work, जो सदियों से करते आए हैं, ये अभी भी after the pandemic they have got back into having to do a larger share of the household work. Learning deteriorates, the learning environment ज्यादा conducive नहीं है. आप घर में बैठे बैठे एक लैपटॉप या एक मोबाइल फोन में अगर 3 बच्चे हैं, 4 बच्चे हैं, then the, you know, what happens to the resource allocation, how much actually comes down to the girl child. The loss of household income itself for all families will affect again a girl child's education. The fact that income earning responsibilities increase for women in this resource constrained atmosphere. The disruption, more importantly, to access reproductive health services ho, तो हम education के बारे में जब बात करते हैं, we cannot leave out the discussion on health, on you know, access to resources, and all of these are interlinked. So therefore, what happens to a girl child in this context is that there is a disruption to the access to health services, to reproductive health services in particular, to safe spaces, jahan pe girls can be able to operate or learn in an atmosphere without the fear or threat to life or self, and the gender-based violence. There are some reports that say, a UNESCO report, which actually says कि 3 महीने का close lockdown से भी 1.5 years का learning loss होता है for all children. तो ये 3 महीने का जो measures भी हुए हैं, इतना सा learning loss है. उसके अलावा we also have the cost of internet data, the limited access of deprived communities. All girls do not come from a level playing field. This will have to be a much more active kind of commitment for us to realize that there will be women's leadership, there will be success in education for girls and women with minimal resources. At the moment, we need to emphasize on the need to challenge why there is minimal investment.
One of the very important things that I really want to share with everyone, being a pediatrician and with having worked with maternal and child health in remote rural India, have understood many things. And one of the most important things that I have understood in my work is that health is not an isolated issue. It cannot be just the responsibility of the health people. If we, as people who want to improve people's health, especially women's health, we have to look at it in a very comprehensive, integrated way, because बहुत सारे issues है, जेंडर बायस भी है, उसके साथ भी many issues है जो हमारे औरतों को बहुत अफेक्ट करती है. और ये जो बातें औरतों को अफेक्ट करती हैं वो पुरुष को भी अफेक्ट करती है हेल्थ, बट क्योंकि she's a female, she's a lady with a little, the effect is much more marked in her case. हुआ क्या कि हॉस्पिटल्स एडजस्ट हो रहे थे, और हॉस्पिटल एडजस्ट होने के टाइम क्या हुआ कि कुछ हॉस्पिटल्स में अभी केवल पेंडेमिक के लिए वार्ड्स खुले हुए थे, नॉर्मल नॉन कम्युनिकेबल डिजीजेस दूसरों के लिए खुलने में, एडजस्ट करने में थोड़ा टाइम लगा, हो गया था. उनको एम्बुलेंसेस भी अवेयर थे, पर जो लोग अनपढ़ थे या थोड़े से हेसिटेंट थे, दे कुड नॉट रीच आउट टू द हेल्थ सर्विसेज, ऑल्दो कम्युनिकेशन was there and people were trying to tell them that you health services are open, आप जाइए. तो ये सारी चीजें हमने देखी. The marital status of women is also very important. तो health में अगर औरत married है, good relationship husband, and she has some power to make household decision, तो उसकी health services बहुत अच्छी होती है, वो आगे आ जाती है. But women who are either single or women who are divorced or widow become much more marginalized. और ये हमने इसको भी देखना होगा कि how to empower these women much more, and this they can be empowered in many ways and health gets affected. सबसे मोटा जो मैं बात करना चाहूँगी कि अगर वुमेन्स हेल्थ की अवेलेबिलिटी और एक्सेसिबिलिटी देखनी है तो उसकी साइकोलॉजिकल एटीट्यूड उसकी स्वयं की, उसकी फैमिली की और उसके जो समाज में रहती है उसका बहुत इम्पोर्टेंट है. And most times, because of a psychological attitude towards not caring too much for her health, she delays seeking health services. और ये चीजें क्योंकि जब पेंडेमिक हुआ, क्योंकि और काफी चीजें मुश्किल थी, there were many barriers on our pathway, including transport and otherwise, तो ये और भी ज्यादा बढ़ के दिखा. And we have to work towards making women very conscious of her health, seeking health services, क्योंकि वो अपने आप का सेल्फ इमेज और सेल्फ वर्थ कम समझती है, और उसके साथ ये एटीट्यूड उसको सोसाइटी भी देती है, फैमिली भी देती है. तो दिस इज अ वेरी कॉम्प्लेक्स काइंड ऑफ attitude that women have about holding themselves back from seeking health services. Or very often we find that young girls and women are very, very shy about reaching out to health. तो ये shyness को भी handle करना है कि how do they, and fear of doctors, fear of treatment. So the struggle for a woman to come from the periphery to a place of health is one of the biggest challenges. And I think the good thing about ambulance and other public health services for women have to be increased if they have to reach their place of service.
You have suggested that I speak on, which is safety and security of women. The question of violence was specifically mentioned by Apurva. And in the context of that, I would like to highlight once again, violence is not just a physical act. It is when physical violence is the increase in domestic violence. During this lockdown period and this pandemic. You see, the point is, it's the lockdown period. It is the confinement of people in specific spaces which increases the tendency and which intensifies the contradictions. तो समाज के हमारे भीतर जो जितने अंतर्विरोध हैं, सामाजिक अंतर्विरोध, वो कैसे बाहर आता है, और फाइनली सबसे कमजोर तबका है, the most weak element in our social structure, they are the victims of that violence. Now, prior to this, we had an act against domestic violence, which we have passed. When we think of the legal provisions that are there have been many legal provisions which have empowered women. For example, the right to property. If you take of the right to property, we do have the right to property in law. Similarly, for the first time, domestic violence, because at that time, अगर आप सोचें कि लोग ने बोला कि क्या घर के अंदर, घर की चौकट के अंदर जो हो रहा है, वो तो सरकार की क्या ये रही है उसमें? How can they interfere in that? But it was a big battle to say that yes, जो घर के अंदर हो रहा है, after all, Indian women are citizens first. And therefore, what happens even within the four walls of the house, yes, there has to be some legal constraints on that, and there has to be different ways of empowering women. Now, what I want to mention this, when we say safety and security are a sort of such a wide term. When we say safety, क्या सिर्फ शारीरिक safety important है? For a woman to live a safe life, you have to give social security, give economic security and political security. There are so many dimensions that will give you a certain sense of security to be able to face the world. But as we know, some of these things, yes, there have been important achievements. The laws that we have in our constitution on the law books have been important, but they have not been sufficient because often they have not been implemented properly. And in order to get them implemented properly, you need to have a whole society which is educated in these issues, which is educated in what it means to build a democratic society. मैं ये कहना चाहती हूँ कि हमें एक जनतांत्रिक सोसाइटी को हमें अगर करना है, तो we cannot have a society which is gender equal, which has gender justice, but at the same time it is undemocratic. It is not possible. So we have to think of a society which is all the time thinking in terms of the whole society.
मेरा नाम त्वरिता गुप्ता हुआ और ऐसा नेम भोजपुर महिला कला केंद्र। और मैंने जो काम अपना जो शुरू की थी, ये स्कूल टाइम से ही मैं शुरू की थी। और अभी मैं 50,000 महिलाओं को मैंने ट्रेन किया है और 10,000 महिलाओं को रोजगार से जोड़ा है। हमारे यहाँ एक क्लस्टर है मिनिस्ट्री ऑफ टेक्सटाइल का, जिसमें 500 महिलाओं को हमने जोड़ा है, जो ज्वेलरी बनाती हैं, क्रोशिया के काम करती हैं, एप्लिक करती है, सुजनी करती है, सिक्की बनाती हैं। और हमारा एक मिनिस्ट्री ऑफ MSME का भी हमारा क्लस्टर है, जिसमें हमारी भी 300 महिलाएं हैं, स्पेशली वो क्रोचेट का काम करती हैं। और उषा कंपनी के मैं पार्टनर भी हूँ। बिहार झारखंड में मेरा 3,500 सिलाई सेंटर चलता है और वो भी महिलाएं अपने पैरों पे सक्षम है। महिलाएं जो है अपना बुटीक चलाती हैं, ट्रेनिंग देती हैं, स्टिचिंग का काम करती हैं। तो हमारी जो जीवन थोड़ा सा संघर्ष में जरूर रहा, क्योंकि मेरे बचपन में पापा तो थे नहीं। मैं पढ़ना चाह रही थी, पढ़ने का भी पैसा नहीं था, तो मैं खुद सिखाई। और जब मैं पैसा कमाने लगी, कि लगा कि मेरा चलो पूरा हो गया, तो मैं गांव में जा करके मैं महिलाओं के बीच में मैंने फ्री ट्रेनिंग करवाया। और फ्री ट्रेनिंग करवा करके महिलाओं को छोटा छोटा रोजगार से हमने जोड़ा। महिलाओं को रोजगार से, जैसे कि हम लोग आर्टिजन कार्ड के तहत हम लोग जुड़े, ग्रुप बना करके हम लोग जुड़े, इस तरह छोटे छोटे ग्रुप बना करके और हम लोग उनको रोजगार देते आए।
First of all, a very warm and a very happy International Women's Day to all the women panelists, women participants here in our webinar, and also to the men in our webinar who have been like a support system for all the women out here who have always supported us, motivated us to walk on this road of thorns all alone and walk like a leader. Then all our panelists, like for me, International Women's Day is like a festival where, irrespective of color, caste, creed, all women just come together on one common platform where we are all equal, we feel equal, and we talk about our achievements, our challenges, the opportunities we have got, and the ones we did not get, but still we came out victorious. Vishwa Yuva Kendra organized one such webinar and tried to give a platform where all of us, we could come here and talk about our life. From different walks of life, we are coming here to talk about our small instances and achievements. I would like to thank Dr. Ranjana Kumari ma'am. She was here just for a little time, but she even her little time was very important and very valuable to us for all the insights she gave us. To Professor Kalpana Sarathi ma'am, Padma Shri Dr. Shama Maitre ma'am, Basanti Raman ma'am, and Srimati Anita Gupta ji, all of you, all your time, all your insights, all the knowledge that you've shared with us. And to be very honest, this webinar makes me feel empowered today. That we all are invigorated with the right energy, with the right power. And yes, we are the present, and yes, we are the future of the country and of the world. So thank you so much, ma'am. Thank you so much for joining us, for being with us. And also my very special teammates and our Sir Uday Sir and Ajit Sir for giving us this opportunity to take over this webinar, and even being the leaders for this webinar, for giving us the belief, for the faith that yes, we can do it, we can carry forward, and we can take the baton in our hand of leadership. Thank you so much for the webinar. Thank you.
Thanks for watching. For more updates, please subscribe to our official YouTube channel and follow us here.